which many of you are very much aware of and even have been long-standing members of long before I got involved in it. I'm a newly elected board member, and we have a group of incredible people who are sitting at the board of Global Health Council now and are really sort of gearing up to reinvigorating the organization to take it to a new level, hopefully to a level that you all would like to see the Global Health Council get to. It's been already 2 days of the World Health Assembly, 2, I would say, very incredibly active days. And we've had the good fortune of very lively debates here at this side event, as well as many other side events. Before I introduce our speaker, I would like to make 3 points, drawing from Margaret Chan's speech at the WHA. 3 points that I think have been very silent. Now, I'm actually leaving Geneva tomorrow morning, and so I'm mentioning these 3 points with the hope that somebody will take these points forward in the upcoming events and side events that will take place during the rest of the week. So in her speech, she talked about domestic financing. She talked about the threat of obesity and the lack of reversal in obesity trends. And lastly, she also talked about violence against women. And I'm afraid to say that I've noticed that it's been quite silent on these 3 issues in discussions that I've been at over the last 2 days. The issue on domestic financing, I will say that there is a lot of hope there from my region in Africa. But I would say that we need some technical assistance to help pair government with the private sector most effectively. And there are people in the room who work on this. So hopefully we can engage in more discussions over the next few days as to how this TA can be mobilized to countries and continents that are ready to actually step up in domestic financing. Nigeria, where I come from, is an example of such a country. The second thing is the issue of obesity in countries in Africa where the fast food industry is making a fast footprint around the continent, yet there isn't enough dialogue with governments as to what the impact will be for us and obesity. And so there again, I think there's need for technical assistance. It's happening really rapidly as companies are making huge profits in the fast food industry in my region. The third thing is the issue on violence against women. And here I'm begging for a dialogue on integration, really. As we talk about maternal and child health, we can't advocate for the child's care or advocate for the mother's care if we don't look at the silent issues around violence against women. And Margaret Chan mentioned this. Now, I can only speak from my region on this, but where I come from, it's actually a taboo to talk about some of these issues on violence against women. And they're hidden behind the veil of culture and behind the veil of honor. There are lots of practices against young women, rape, various different types of practices that are going on. There is also a lot going on with young women who are getting married very early, as well as widowhood practices. So I want to encourage and sort of spur and hopefully catalyze discussion on talking about what it's not appropriate to talk about. And it's these violence against women, the crimes against women that are hidden behind culture and behind honor. And I'm hoping that in the coming months to years that we can start to tease out what is culture and what's crime in that area. So that's sort of my contribution to the dialogue. Without further ado, I have the great pleasure of introducing Dr. Luis Lores, who is the Deputy Executive Director at UNAIDS. He's been sent over to be with us this evening, and it's my pleasure to welcome you, sir, representing Dr. Michel Sidibe. Thank you and welcome.
Merci. Good evening, good night. Thanks for inviting UNAIDS to be with you in the closing of this important meeting. I will be very short. First of all, let me say that in times of crisis or times of change, like we are getting now, is a lot of hope, mainly when we have hope, in terms of the changes ahead. There are things that are very important, and we learn that from history. First of all is leadership. There is no time that you need more leadership than when you face a crisis or when you are in a moment of change. And that's exactly where we are. And we need some trailblazers as well that can help innovation to come through if you are looking for change, if you are looking for new times. I think the meeting that you had today and the publication that I have in my hands, I think show both. I think leadership, that convene the leadership that we need from different parts of the society, but more than that, brings innovation. I truly believe that there is no hope in post-15 if this movement from the start does not bring non-state actors and does not bring this kind of partnership that's broader than only a state-based partnership to move the discussion forward.